Good evening, I'm Barkha Dutt. You're with the Mojo Story. During the course of this pandemic, there have been many ill-informed, unscientific conversations through the pandemic. Some were from lack of enough knowledge, but some have been pure stubbornness and a consequence of mixed and confused messaging. The debate around whether to reopen schools and ask for physical attendance is one such and is the focus of our conversation today. Let's bring up our big story on the program today. We're looking at the debate around the reopening of schools. Even where these schools have opened, the attendance is extremely thin, and that continues to be a real crisis for the education of children. We're asking today why, in the face of scientific evidence, the latest is from the United Kingdom, that is saying that children between 12 and 15 years do not need to be vaccinated, why parents are persisting. Many parents are with not sending their children to school. In India, we are still talking about vaccinating kids, but the All India Medical Chief Head, Dr. Guleria, who's also leading the country's COVID response, says that process could take up to 9 months. Indian schools can simply not afford to remain closed for another 9 months. The Parliament panel itself, looking into this issue, has said that the education of 23 crore children has already been damaged, and that is a conservative estimate. Besides the impact on education, there may be no good medical reasons to keep schools closed anymore at all. As science evolves, why aren't our parents and principals evolving along with it? We know so much more about COVID today than we did 16 months ago, yet our conversation remains stuck in the past. Let's bring up our experts on the program today as we ask why there is so much resistance to the physical attendance by students in schools. Introducing our guest today, we have Dr. Brian Wahl, who's a well-known epidemiologist, just has a very interesting column out making a prognosis for the reopening of schools. Dr. Chandrakant Lahariya has been arguing for the last 48 hours on Twitter with many people who've been saying that schools should not open. We don't, we're not at that point yet in this country. Dr. Sanjeev Bagai is with us. I've been following his comments. He's not convinced that this is the time to reopen schools for kids. And bringing a principal and an educationist perspective, we're joined by Sadhana Bhalla. She's the principal of Mira School. And let me start with you, Chandrakant, if I can. You have made an argument that, one, there is no need to link the vaccination of children to the reopening of schools. In fact, you've been consistently arguing that young children may not need vaccination at all. And the other point you're making is that we should be talking about things like ventilation, masks, instead of saying a blanket no to the reopening of schools. Where do you find the confusion is? Where do you find the resistance is in accepting your argument?
Barkha, so the main point is that school opening after such a severe second wave is going to be a challenge because people have their apprehension, opinion, fears, and all of that. So the first step in school opening had to be a conversation or dialogue around where the fears and apprehensions of the people are addressed. And whenever that process would have started, it would have taken its own good time. It is really unfortunate that in India, till very recently, there was no discourse on opening of the school. However, in my opinion, this should have started soon after schools were closed in last March. So now it has started, and then there are many opinions, and people are often quoting or citing that second wave affected people. And that's why we should be apprehensive of third wave and we should not open school. But we need to remember a few things. As you also correctly highlighted, that in 17 months, we are slightly wiser than what was the situation in March or April last year. That time virus was completely new, but now we have experience from more than 170 or 180 countries, many of which kept school open or closed for a shorter period. What we know now, that vaccination is not a prerequisite. We know that schools are not super spreading places. And we also know that no country is doing vaccination. But current challenge is that people have taken a really hard stand. Some of them are misinformed and they are waiting for vaccines, and even medical fraternity and all of those. Unfortunately, everybody should not and is not able to look at the entire data. Individuals have formed individual opinion, personal experiences, medical experience, other things. In this, I personally think that personal opinion or common sense would not work. What we should be doing, we should be looking at the data at holistically. Yes, parents have a genuine concern. Those concerns should be addressed. And all of the stakeholders, parents, school teachers, medical experts, education experts sit together, understand what are the common concerns of the parents, and that's how it will be addressed.
Yeah, let me bring in Sadhana straight away. Tell us about what's happening in your school. Is it open? Is it closed? And if it's not open, why is it not open?
So we tested with class 12 in April, and we were fine, and we felt confident that we could bring in children in shifts, and we're maintaining all the protocols. But I think now it's no longer a question of whether we should open or close the schools. It is, I agree that there has to be a community, a confidence building exercise. There's so much misinformation, and the more information and solutions are coming, vaccination, no vaccination, not needed, I think the whole situation is becoming so volatile, uncertain, complex, and ambiguous. And it starts from the orders from the government, where they say open the schools, but take the they're not say coming out with confidence. They say take the consent of the parents. That immediately puts a doubt in the minds of the parents, and they're resisting, because the second wave, which took them by, we were caught unaware, and we were very comfortable that first wave, it's over and now it's not going to come back, and it hit people so badly that they cannot forget that trauma that they had to go through, with no hospitals and oxygen not being available. So that is a very recent conversation. So they need somebody telling us, no, it's fine. Children don't need vaccination. It has no connection with it. And I think the moment they stopped, the highest court of the country got in and said no boards, that immediately threw back the whole conversation. And now coming back and bringing them to school is going to be a very, very big challenge. And that's where, despite having orientation...
So hang on. Your school is still closed?
It is, and I'm going to open it in October, and I'm ready for it. But it's just a question of parents not agreeing to send. They don't have the confidence to send the children to school.
So your school is on a hybrid model, or is it entirely closed for physical attendance, Sadhana?
It is. I have kept the option open, but nobody is willing to come. So right now we are going into exams from Monday, but October I'm not giving a choice. I am calling the children in, because by that time I think there'll be 3 weeks of discussing this issue with the parents and the children.
So I just want to make a couple of different points. One is the impact on education. We already know that children are actually losing learning skills. They're losing cognitive skills, and study after study has shown that. The other is the digital divide. We have millions of children falling out of the school system. We are a country where less than 15% of Indians have access to a computing device. And lastly, we are having the wrong conversation. We should be talking about vaccinating adults, vaccinating teachers, moving activities outdoors. Brian, those are some of the points that you made in your column, that it's the wrong conversation that's taking place. The conversation is still stuck either on vaccinating children or on some sort of archaic idea of fomites transmission by touch, sanitizers. We're like stuck in April of 2020 instead of the September of 2021 when it comes to schools. So walk us through what you think we should be talking about and we aren't when it comes to reopening of schools, Brian.
Absolutely. So, Barkha, just one thing I wanted to highlight. When the decision was taken to close schools at the very beginning of the pandemic, we, as you mentioned earlier, didn't know a lot about, or at least as much as we know now, about the virus. One of the reasons that the decision was taken to close schools was because we've seen with other respiratory pathogens, namely H1N1, that schools and school-going children did drive transmission of that virus. And when you closed schools, you saw that transmission was disrupted. As we've learned more about COVID, we know that children do get infected and do transmit to others, but are not the drivers of infection. And so it's important to keep that in mind when we think about the interventions that we are using in order to minimize risk and minimize infections, and most importantly, minimize severe disease and hospitalizations and deaths. So in the schools, I think, what we found in some of the research that we've undertaken is that now, given the situation in India with relatively high seroprevalence, high exposure to the virus, and vaccination, which is ramping up among those older than 18 years of age, opening up schools poses a minimal risk, a minimal additional risk to both children and most importantly to parents when bringing children back. The things that we can do to drive that risk even further would be to improve ventilation, to make sure that teachers and parents of children who are going to school are also vaccinated, and even in the general community, ramp up vaccination as much as possible. Look at outdoor options for teaching that we know reduces risk of transmission as well.
Okay, so a lot to unpack there. Dr. Bagai, I saw your tweets. You're not convinced. And one of the arguments you make is that if there were to be a large volume of children who were to be infected. And let's be clear, one of the things that Brian does say is that the reopening of schools, like anywhere in the world, when you unlock any activity, can lead to a spike in infections. So we should be ready for a spike in infections. I think the argument being made is that it is highly unlikely to be a severe set of mass infections that would need hospitalizations. But you are making the argument, Dr. Bagai, that is precisely what you fear would happen, and that India doesn't have the infrastructure. But nothing that has happened thus far tells us that children are vulnerable in that way.
Thank you for having me on the show. So let me first of all partly disagree with a lot of statements being made so far, at least on the show. And I'm basing this on publications. If anyone can reach out to me, I will give them the names of the publications, authors, co-authors, and the dates, and the total number of series of cases which have been analyzed. We have to go scientifically. There are 5 major parts in this discussion, and this is extremely sensitive because 40 to 45% of Indian population is pediatrics out of 138, 139 crores, which is about 45-50 crores. Now, let's talk of first the virus. We are not talking of the alpha strain or the wild strain, which was last year. We're talking of a delta strain. Without going into the micro details of it, I can talk on hours of it. The R0 is 8. It spreads more than 60 feet. It is micro aerosol, airborne. It can have a long jump COVID. It can go from one classroom to another classroom without a physical change of presence of students leaving from one room to another room. It can remain suspended in the hours for 9 to 11.2 hours. You can have a fleeting contact, just merely 15 seconds. It's not cumulative 15 minutes, 15 seconds. That's about the Delta strain. The Delta strain is also shown to have a spike in number of admissions overall worldwide, in terms of ICU admissions, in terms of death, more than 4-folds, 4.5-folds, and it shows a vaccine escape and an immune escape mechanism too. So that's with regards to the Delta. So we are dealing with a new animal on the block. So this is a very dark monster in a terrible alley. Let's not compare this with what was happening last year. Point number 2. Now let's talk about the children. The children who are in India, at least, and I'm basing this first on India and then within the international experience, are 100% unvaccinated. The CDC data, which was published last night, and I'm quoting as recent as 12 hours back, the CDC data of July and August in USA, that the kids who are unvaccinated have 10 times increased risk of being hospitalized, and overall children in US have shown a 5-fold increase in hospitalization, children above the age of 5 and including 12 to 18. We know that this is a potential fear with regards to the spread in children. There are certain states, especially the southern states in US, who have shown a 400% increase in the pediatric incidence. In Florida, Texas, Louisiana, Israel had the same experience after the schools were opened. So did UK. Now let's come to the.
Can I jump in there? All the countries you cited actually kept schools open. They did not shut their schools. We've had the world's longest school lockdown. We're the top 5 countries of the world. So all the countries, despite the CDC data, the US and the UK have schools that are open where kids are going to school. So just wanted to make that point.
Yeah, a lot of them did actually close down intermittently too. But now let's focus on an environment which we call as a school. Even if you have a hybrid model of some students coming in the morning and some in the evening, or you have a hybrid model on online and offline, and I think both the models should be implemented, but from end of the year onwards, schools can potentially focus to become a super spreader event. Now, I'm quoting studies from Journal of American Medical Association, in which school reopening has given a jump of 4.3 folds. These are published studies. These are not off-the-cuff percentages which we are pulling out of the hat. We know that these can potentially turn out to be super spreader events. Keep in mind that children, two last points, Barkha, keep in mind that children who are even asymptomatic carriers, and again, worldwide data of more than 17 million genomic sequences have shown that children are 49.5% asymptomatic carriers. The largest section of asymptomatic carriers are children. Children carry the same viral load, but they transmit 47 times more than adults. The next and the last important point is the children's immune system releases peculiarly to the Delta strain specific enzymes which we call as hormones. And the hormones are alarmin, secretin, protinin, and zumulin. These are the reasons why the children in the Delta wave worldwide had a lot of gastrointestinal symptoms, but these are released from the intestines.
Okay. You've made a lot of.
And the last point.
Yeah. Hang on. You'll get time to make other points. You'll get time to make other points. I want to take some of what you've said. Okay, let me just first do this. Yeah, I want to take some of what you've said around the panel. Now, I'm not a doctor, but this business about children being vectors, which is very efficient carriers of the virus, could be addressed by vaccinating more of the adult population. It still doesn't necessarily make a case for keeping schools closed. Point one. Point two, if schools are to be treated as super spreaders, we are a country that has open malls, restaurants, gyms, pretty much everything. And we don't look at that as super spreaders because we link it to the economy. But the most important thing for a country, the education of our children, is not prioritized. But those are my views. Let's pick up on some of the medical arguments you've made. Brian, I know you did a previous study where you researched children and the capacity to carry the virus, and there was some concern about children being vectors, which Dr. Bagai has flagged. Would you like to respond to that and some of the other things he's said?
Sure. One piece from our research in Tamil Nadu and Andhra Pradesh. So data specifically from India, and using state contact tracing data, we found that children absolutely do get infected and infect others. However, as I mentioned previously, we did not find in our study that children were driving transmission. During the initial epidemic peak in 2020, it was not children that were driving the peak. The other thing you can consider is both the peak in 2020, the first national wave, as well as the second national wave in April and May of this year. Schools were also closed then, and that did not prevent the tremendous wave that we saw during those times. So I'm not convinced that children themselves are driving transmission and driving epidemic waves, and I think it's important to keep that in mind. I would love to see Dr. Bagai's evidence that he was citing, and we can go back and forth maybe on another platform of that evidence.
Chandrakant, 2 points that you have consistently made. One is that when a lot of people feared, and they've had to take that back, that the third wave, whenever it does come, if it does come, could specifically target children. You argued against that, and even the Maharashtra task force that itself thought that at first has revised its own opinion on that, as is the Ministry of Health, that there is no scientific evidence to show that an imminent or wherever it comes, a third wave will specifically make children vulnerable. One. Two, you have consistently made the point that children do not necessarily need to be vaccinated, borne out by UK. But Sanjeev Bagai is quoting the Americans who do have a vaccine for kids under 18. Please come in on what you've heard. And what happens is that parents hear this division among the scientists in the medical community, and they're like, we don't understand it, let's just not send our kids to school.
So I think I'll answer this in two parts, one on epidemiology part and second on vaccine parts. The first thing we need to remember that there is no data, and I'm repeating, there is no data that Delta has any special predilection for children, which essentially means the Delta is very similar to any other previous virus as far as children are concerned. It's linked to ACE2 receptor, which virus need to bind, and it remains unchanged. That's one. Second thing we need to remember that we cannot directly compare United States and India. The reason being India has already overpassed Delta variant, which is now affecting United States. That's one. Second is the US, specifically people are really openly opposing mask wearing, even in the schools. So mask adherence is really low in that setting. And we have already crossed Delta. That's one. Third point I would like to highlight that the rate of moderate to severe illness and mortality in children is really low. It's so low in the range of 0.2% of the total cases and deaths to like 0.003%. And we are talking reported cases. So in that context, I would be little cautious even if number of cases or hospitalization increased by 400%, because what we are talking are really low value. So 0.0003%, if there is a few additional cases, it will be 400%. So percentage value is not really useful. What we need to see that what proportion of cases it has become in comparison of previous period. And this number would still remain really low. I'm repeating this thing, 0.0003.
Can you explain this? If you were an advisor to a school, let's say you were advising Sadhana Bhalla and you had to address a parents' town hall, and you had to demystify, which is actually what I think all our doctors, government needs to deploy doctors to go into schools and talk to parents. But if you had to address parents today in Ms. Bhalla's school, you would say what, Chandrakant?
Okay, so I would say this thing, that there is a limited data available, but whatever data available from different settings, for example, United States has a really robust data. For every 1,500 deaths happened in adult, only one death has happened in children. So the proportion of death is really low in children. And the number of hospitalization is also very low in majority of the settings. In the worst case scenario, the worst ratio of where we heard a lot about Indonesia, that number of children are getting affected in Indonesia is really high. Even in that setup, for every 100 mortality in adults, only one happened in 0 to 18 years. So number of deaths are really low. And only those children who had a pre-existing condition were dying. None of the child who was healthy were dying due to. Even hospitalization rate remained low. For example, in India, 0 to 10 years of the total hospitalization, only 3% happened in 0 to 10 years. Around 8% happened in 11 to 20 years. So total 11% of the total hospitalization, moderate to severe illness and mortality were in India in children, while children contribute 40%.
So I'm going to be really coarse here and make one of my favorite points. And I mean this not in a callous way. I think many of you know, I've had COVID. I lost my father to COVID. So I do not come from a place of slighting anybody who's dealing with this. I just wanted to preface that. But I'm going to say my favorite sort of response here, Chandrakant. Is it time to start saying getting infected is not necessarily the biggest deal? What you have to focus on is reducing the impact that infection has on you. And therefore, vaccinating adults is where our focus needs to be.
That's exactly. We are at a different stage of pandemic where in every infection, it does not matter. What matters that what is going to be the outcome of that infection in that individual. And we know that outcome of infection in adult is really severe. Outcome of infection in children is really mild. They mostly would get a mild illness. So just last point to remember here is that since most of those children who will develop moderate to severe illness can easily be identified, pre-existing condition. So schools might not be safe place for those children, but we know that number is going to be around 1 to 5% of total children. 90 to 95% children can be easily go to school, and that too without vaccination. Please allow me last 1 minute to speak about vaccination.
Can you hold on? I'll come back. Let's separate, because if everything gets argued together, then we forget it. So I want to pick up what you've said. Kids with vulnerable health, don't send them physically to school. Instead, focus on vaccinating adult populations, vaccinating teachers, vaccinating school staff. And urge kids to wear masks indoors, not outdoors. Let's be scientific. Now, Sadhana, Bhalla, I'll come to you, Dr. Bagai. I know you have a lot to say on what you've heard. But as a principal, what are the kinds of questions you get from parents when they say, no, we won't send our kids? Are they still stuck in that old world sanitizer, टेबल पे हाथ लगाने से कोविड हो सकता है, contactless delivery? We need to stop some of these things. Has anyone communicated with you? Have you had somebody come and speak to parents? Do you know where to turn to ask these questions?
So, starting at the last question, I really don't know who we should approach, because there is such an overload of information and conflicting information. So we're doing whatever. I'm speaking from the perspective of a school, where we have brought in children in April, May, and we've been quite safe. One child did get affected, but it was because of a community, the child had got stuck with a family member who had COVID. But having said that, we have to have courage and start somewhere. Maybe the third wave is already here, for all you know. But the question that parents often ask is the school ready? And for them, I say with confidence that the school is ready. We are confident we can bring in children. We are not very sure how they commute to the school. Ours is a neighborhood school. So what happens between their homes and the school is something that we need to...
How do the kids normally come?
They either cycle, or they come by rickshaws, or they walk down, because it's just 5 kilometers radius, and everybody, because we don't have any school buses. So we've been very clear about that right from the beginning. But the challenge, the school, they're feeling, and we have exposed our children to schools in bubbles in April and May, and we find that we are ready, and we have to, but there is still scope for improvement. Of course, each day we understand better technology. But right now I have a board center, and the exams have been going on for the last 10 days. And so far, so good. We've been okay, and the children are comfortable. So the whole purpose of this conversation is that we should be educating and taking a step back and saying, how and what do we educate our children and parents about?
I think that's the gap, right? There is no centralized communication on what schools should do and what they shouldn't do. Instead, there's a bunch of us arguing amongst ourselves. And I can understand that can be quite scary for parents. Dr. Bagai, may I please ask you why malls, cinema halls, restaurants are not super spreaders, but schools are?
Sorry, is that for me?
Yes, it is.
Okay. I think these places which have been opened are also potential super spreaders. But doing multiple wrongs doesn't give you the liberty to inflict one more wrong on the society. Absence of evidence is not evidence of absence. Let me straight lock horns with the previous panelist, and let me give him some data. Children, and I'm talking deeply scientifically and genomically, so that it's authentic as it can get. With the Delta strain, which we know was the major cause of 18 major surges worldwide when India was undergoing the second wave, children have what we call as protein sensor receptors. And this is disabled by the Delta strain specifically because the Delta strain doesn't attack the receptor binding protein and the ACE receptors. As my previous doctor panelist has mentioned, it actually attacks the N-terminal domain much more. And it does not rely, I'm repeating again, it does not rely on the ACE receptors. It hijacks and hitchhikes through the endocytes into the protease and disables the immune system. So the pathology and etiology is completely different. I don't want anyone to misunderstand that this is exactly what we were talking about, the ACE receptors.
If you're not a doctor, what does this mean?
That means that the Delta is much smarter than we are thinking it to be. As simple as that. So we need to treat it with much more caution.
My understanding, I have a question. My understanding is that the Delta is more contagious, not necessarily more lethal. Therefore, the denominators are higher, but there is actually no science to show that it is more fatal or more lethal. Please correct me if I'm wrong. But I've heard...
You're absolutely wrong. There is enough data. There is volumes of data to show it is more severe. It takes lesser time from the nose down into the lungs. It takes more time in terms of fever, and it replicates much faster. The CT value on the RT-PCRs is lesser. The febrile illness is more, and your gene per breath is much more in Delta
Okay. I've got many varied opinions on this, but I won't argue with you. My question is this. You said if a mistake has been made with the malls and the theaters and the restaurants, why make it with schools? Are you really suggesting that we should remain in lockdown in perpetuity?
No. But please allow me 60 seconds to complete my point, and I'll answer your question in another 10 seconds. There is enough data, Dr. Lahariya, enough data which is published in nature.com and in Lancet. I can give you the links. You can go through the studies, and you can't disregard international data. 19.9% was the admission rate in these studies in children who had COVID, with 3.6% death. Please understand, the largest fraction of long COVIDs in asymptomatic carriers is in children. And to impact them with 29 body organs with long COVID for more than a year is not fair. With regards whether they are unvaccinated or vaccinated, of course they are unvaccinated right now. I'm not hinging my argument at the present moment that all kids need to be vaccinated before they go to school. All what I'm saying is we should achieve a particular level of community-acquired immunity through the adult vaccinations. Every 20% of the adult vaccination increase is going to decrease two-folds the community-acquired transmission. That is extremely important.
Okay, hang on. So you're saying that there needs to be a critical mass of adult vaccination before we can look at school vaccination, school attendance. Let me bring in Brian and Chandrakant here, right? Chandrakant, I'll start with you. I don't really want this to be a technical conversation about the Delta variant, because it will lose most of our audience. I think what parents, children, regular people want to know is it okay to go to school? Is it not? If it's not safe, how long is it not safe for, and what can we do to make it safer? Chandrakant.
So let me start with the Delta part, and I'll keep it simple, not the technical one. So even if we agree with Dr. Bagai, I don't agree, but let's assume that whatever he's saying is true, that Delta is more transmissible, which is true, but more lethal. Then we should also remember that Delta variant is already passed through India, and some of Indian states have already more than 80% of seropositivity. That's one. We also found that 60% of children were found to have antibody, which essentially means that if 60% already developed infection and things were not that worse, so remaining 40% would be the only one, because all 60% of children develop natural infection, which lasts really long, provide immunity. So only 40% are susceptible. That was in June. So essentially the pool of children, which is susceptibility really small, so it will not be very severe. It's over for India. What it means, schools can definitely be opened. Let's go with that argument. And many of the states which have reported more than 80% seropositivity, Madhya Pradesh, Uttar Pradesh, Bihar, in rural countryside, no case is being reported. In those settings, schools can be opened. And the urban setting, children are playing with each other, and they have been exposed. Like All India Institute of Medical Sciences and WHO conducted a study in 5 cities. And that study data was collected in April and May month, before the second wave was completely reached the peak. And that study found that children had a seropositivity somewhere in the range of 75 to 80%, well before second wave. So my argument is that based upon data, Indian data, it can be said that children have been exposed, and they have been exposed extensively without many severe outcome. And that's why there is no reason to believe that children would be affected any which way severely in subsequent wave. Children do not need vaccine, because this is the last part and I'll stop. For simple terms and for parents, if we agree that we want to reduce the transmission, currently licensed vaccines do not reduce transmission. 2 things we need to remember as parents. Vaccines are intended to reduce moderate to severe illness and mortality. Children do not have that moderate to severe illness and mortality. So what they would prevent, they would not benefit much. Second part is that we want to go for a reducing transmission, but there is no scientific evidence from currently licensed vaccine which are being used in India that they reduce transmission. So transmission will also not be reduced. All of this in the long run may be beneficial, but currently children can go safely to the school without any additional intervention other than ventilation, mask, and other vaccination of staff. If vaccines become available, they will be add-on, but they are not prerequisite.
Okay. Brief interjection from you, Dr. Bagai, and then I want to go to Brian. I have to start closing very briefly.
I would like to come in this.
Yes, ma'am. I'm going to come to you. Dr. Bagai, brief interjection.
The greatest thing of medical science is that we learn to agree to disagree. So I disagree with Dr. Chandrakant. The vaccines have been proven in worldwide publications that they decrease the rate of transmission. They decrease the viral load in the nasal passage, and therefore they decrease the community spread. The point number 2, vaccines in children is extremely critical. We don't have it right now. It doesn't mean that it is not important. Vaccines in children have shown 94% efficacy and effectiveness on the ground in the real world in US over lakhs of children. Thank you.
All right,
Just a quick
Brian.
point, Barkha. The vaccines which have been proven to reduce transmission are mRNA-based vaccine. The Moderna and Pfizer-BioNTech vaccine. There is no evidence on Covishield, Covaxin, and Sputnik in reducing their transmission. We assume that they might be reducing a bit, but there is no evidence.
All right, let's bring in Brian, both on the transmissibility sort of consequences of being vaccinated, and to Dr. Bagai's argument is that you need X% of your immediate adult population vaccinated before you can consider sending children back to school.
So just on the point of transmissibility, we do know that from studies around the world that shedding of the Delta variant, so specifically talking about the Delta variant, shedding of Delta variant among vaccinated and unvaccinated individuals is roughly the same. However, a big caveat is that clearance of the viral particles from the nasal passage, which leads to shedding of the virus, is much shorter within vaccinated individuals compared to unvaccinated individuals. So in that way, the vaccines against the Delta variant are likely to reduce transmission. So not fully, it doesn't completely eliminate transmission, but they are most likely to reduce transmission. Now, the other point about making decisions around opening schools based on a target vaccination level, that I would advise against completely. There are multiple ways of obtaining protection against severe disease and death associated with COVID. That is, of course, through vaccination, but also through natural exposure to the viruses. In India, since we have gone through our massive second wave, and as Chandrakant was mentioning, a large number of older individuals as well as younger individuals have already been exposed to the Delta variant through that wave. We should be considering both prior exposure and using seroprevalence studies to do so, as well as vaccination. Obviously, vaccination is the better and safer way to...
And you mean vaccination for adults, not children?
Yes,
right,
exactly. Exactly. Yes.
Yeah.
So vaccination for those who are at highest risk of severe disease and death, and that is older adults.
Okay, very quickly before I give Sadhana, Bhalla the last word, 2 things you tell schools to do before they open up.
2 things that I would say to schools before they open up. I would say that focus on ventilation, making sure that you can minimize transmissibility within the schools. Focus on mask wearing. It's an intervention that we know has high effectiveness. And immunize teachers and parents at home to minimize any additional risk for them as well.
So that's one way to go forward, Sadhana, Bhalla, that you ask all parents to get vaccinated, all household members, adults to get vaccinated. Wouldn't that be a great start?
So we've done that, and I'm very happy to say that 99% of our staff has already got vaccinated, and they're raring to come back. And the only ones left are the ones who were affected by COVID recently, so they have to wait for the 3-month period. So we've been advocating this to our parents as well, that you must get yourself vaccinated, and the entire housekeeping, everybody has been vaccinated on the campus. But our main concern and the question that everybody is asking is, how prepared are our hospitals in the eventuality of the pediatric ward, if the children have to be carried there? Are we ready? Do we have enough facilities in our hospitals in our city? That is the main concern. Otherwise, we are ready to get back, and for a lot of reasons. That's what I would like to say.
Well, it would be restarting this conversation and the disagreement between Sanjeev Bagai on the one hand and Brian and Chandrakant on the other, making the point that actually, as a percentage of infected population, children rarely face severe disease that would require hospitalization, and that India might have already been through the worst, or probably has been through the worst, having been through the surge. I will have to leave it there, but I will say, not as a doctor, but as a journalist who spent pretty much the last 2 years reporting this story, that tomorrow there will be a new strain and a new strain and a new strain, and where will this end? This cannot be how we live, and at some point the world will have to confront these questions. And the countries, respectfully, Dr. Bagai, that you've cited today, schools have not shut for more than 500 days as they have in India in these countries. So it's I understand the fear among parents, but we really need clear, messaging from the central government, from central agencies that everybody agrees on. Like, we can't have this disputed, because that really creates a massive amount of confusion for parents and children alike. Thank you. We'll have to leave it there. Brian, Chandrakant, Sanjeev, and Sadhana, thank you. And to all the students who tuned in to watch, thank you for spending your Saturday afternoon doing that. I hope you can get back to the classroom very soon. Thanks for watching. Goodbye.
Thank you.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.